The more you can hide the baby until it's born, the better. But from who though? That's for me to know and for you to figure out. But seriously, if I tell you, I'll have to kill you. Hello you guys and welcome back to my channel. My name is Laraddiji. If you're watching for the first time, you're most especially welcome to this family. Don't forget to like this video and subscribe if you've been inspired from what you hear today. If you haven't seen the video I posted about the end of my pregnancy that happened last year, please do so at the end of this video. Shout out to my husband, the CEO of Dezigns and Dijicom Creations. He is helping me make all of this look very professional. I'll link his details down below if you need him for video production projects. It's a freestyle week today, so I wanted to talk about the perception of health, first in a Nigerian point of view regarding pregnancy, preventive care, birth, disease, mental health, and death and dying, and then in an American point of view. Well, let's get to it. So as you all know, I'm Nigerian first, and maybe I haven't said this before, I'm a nurse second. I wanted to use this opportunity to enlighten you guys on some perceptions I believe we've come to entertain for as long as I know regarding our health. You see, back then, I struggled when I was in a nursing program in high school. Here in the States, back then, not because I didn't understand English, but because most of the terms I had to learn were all new to me and made it all the more difficult to understand some simple medical terminologies. Thinking back on it now, that was why I almost failed out of the program. Yep, words like diabetes, hypertension, anxiety, hyperemesis gravidarium, glaucoma, like really? These were almost gibberish to me, and thank God I kept on learning. I almost gave up, but I'm glad I didn't. Since I was old enough to know what nurses did back home and how a nurse had impacted my life when I was very sick, I had always wanted to become one. So I wasn't surprised when I said, yes, I want to become a nurse when I was asked by my high school guidance counselor back then. The counselor told my parents, "Oh, we do have a nursing program here in our school," and my second life began right then and there. I had only heard of malaria, hypertension, and typhoid. Imagine my surprise when I learned there was more to life than those two diseases that I had grown to know and hear about. My grandpa died of a heart attack, and I believe this is because of his history of hypertension, but I couldn't grasp what it really meant until when I was learning more about it here in this country, when I was in high school, in the nursing program. Now I feel like I can talk about why my medical knowledge was lacking. Growing up in Nigeria, people were very hush-hush about what they were going through physically and mentally. It was kind of like a taboo to talk about themselves and the diseases they had, or to even get help for important health-related issues, mostly because they were poor or lacked education, or like my dad says all the time, lack of exposure. Even if they were not poor, Western medicine was sort of last option, if all the traditional routes had been exhausted. Now it's kind of the opposite. If Western medicine doesn't do the magic, then they'll turn to the traditional ones, or sometimes they'll use both together. Right? So today I'll focus on 5 aspects of health that I believe are very important to any individual, and the perceptions I've observed in Nigeria compared to living here in this country regarding pregnancy and birth. So what I've noticed now that I'm older is that pregnancies were not celebrated as much as they are here in this country. Even though everyone's pregnancy story is different, and even though the news of being pregnant is a good one, regardless if you're married or not, most likely you won't go announcing to everyone and shouting on a rooftop, when you're pregnant. So they'll most likely just confirm it when they start showing, or not at all. However, here in America, I've noticed the opposite. From the time women miss their period, they are already announcing to everyone. And God forbid if they miscarry, they get a lot of support from those people they've chosen to tell. Not that it's a bad thing, but that's how it is. This is almost like a taboo from what I've learned from the part of Nigeria I lived and grew up in. If possible, the more you can hide the baby until it's born, the better. But from who though? That's for me to know and for you to figure out. But seriously, if I tell you, I'll have to kill you. Anyway, the other aspect of celebrating pregnancy that is not popular in Nigeria when I was growing up is that of pregnancy photo shoots. I'm sure that with technology advancements and access to Instagram, Facebook, and all other social media outlets, this too will soon gain its popularity. So when you ask some Nigerians their due date or if it's a boy or girl and they're not familiar with American culture or its lack thereof, don't be surprised if you don't get an answer. Even as a nurse myself, I did guard both of my pregnancies to an extent because of all I've heard growing up. Nowadays, there's a thin line between private and public information. The younger generation might not be able to tell the difference anymore. So make sure you teach your kids the right way, I beg you. All right. Regarding preventive care, the second one, my perception growing up was that there was none. Unless you were very rich and you understood the importance of healthy living, you most likely wouldn't go see a doctor unless the sickness was very severe, and by this time a medical intervention might be unlikely to save you anyway. So there is, however, an important emphasis placed on antenatal care. Here in the States, however, if you're working and you pay some percentage of your salary to health insurance company, as a single person or as a family, you or your family will be covered, in the treatments or emergency treatments you receive at your physician of your choice. For those who don't have health insurance, the cost of care is higher and sometimes unbearable. You know what? I actually remember a time when I needed a hole in my tooth to be filled. I had a cavity. It was done when I had insurance, and didn't have to pay any money out of pocket. But when I was in college, I wasn't covered anymore by my parents' insurance. My tooth was now shaking, and what happened was I pulled it out myself because by now I was having headaches and couldn't eat well anymore. Unfortunately, I didn't know that my tooth had broken apart into 3 parts, deep into my gums because it became weak over the years, and later it got infected. I just thank God by the time I saw a doctor, I was now insured and was able to take out the tooth without paying too much money. So this is the importance of having health insurance, and I wish our Nigerian government officials would actually work on making healthcare something one can be proud of in Nigeria, among many other issues. The perception of some Nigerians, however, is that once you have enough money to come to the States, then, they will be cared for automatically, which is not true, in so many cases. This is why the orange man can call our homes shithole countries. But for the purpose of time, I won't go further into that. Number 3, regarding disease and mental health, my perception was that none existed. Just like preventive care, I feel like because we are a majorly religious country, we tend to pray more during these times and have faith, that God will heal us. Mostly, we see disease as a test of our faith, while others tend to ignore or deny the problem even exists. And, they think maybe it will go away on its own. Sometimes due to their lack of education or due to poverty. That's why I probably wasn't exposed to people, who had these disorders, when I was younger. And I came to this country when I was 14 years old. So how much could I really know at that age, So anyway, family members wouldn't talk about disease in the first place, talk less of hearing about them. Regarding death and dying, the only person I saw dead, when I was younger was my grandfather, who died of a heart attack, like I said earlier, most likely probably because, due to his history of hypertension, and was he taking his medications, or maybe he changed his lifestyle? I have no idea. One thing is that kids weren't allowed to know a lot about, what was beyond their age, right? Here, everyone knows everything about everything. Since pre-K, you can ask my kids. They know what a volcano and a cave is. They're only 3 years old. I didn't even teach them that. Am I right or am I right? Thank you, Google. Well, I asked my dad and my husband about their experience with death and dying while, they were back home. And what I learned from them is that death below a certain age, let's say below 65, was believed to be unnatural. Regardless of the situation surrounding the person, that person could have been sick, 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 sick. They don't think it's natural. So it sounded to me mostly like cases of coincidences and unhappy endings. If someone doesn't understand the phenomenon of a disease or disorder or an infection, for instance, the blame is usually placed, mostly on the fact that nature or someone is against that person. Over here, though, the individual can buy a casket ready for his or her death if it happens anytime. Some believe that, they don't want to burden their children with funeral expenses. That would be a taboo in my country. Buying a casket before you're dead for yourself is like writing a letter to death. So that's it for that. So regarding healthcare delivery, there's a lot of laws here that prevent a lot of things from happening to patients, like, patient abuse, illegal dissemination of patients' information, and patients' exposure to danger, either through medication administration, medical or surgical intervention. Unfortunately, there's a lot that's lacking in our healthcare industry back in Nigeria. You will find that people who travel to African countries often have to get some shots, before they travel out to prevent them from, getting sick, especially from diseases like malaria, typhoid, and yellow fever. Some have to travel with some basic medication, like pain relief, bug sprays, and others due to lack of important supplies by community clinics and, some hospitals. People actually pray not to get sick because the healthcare system over there lacks too much, to get sick over there. Trust me, you don't want to get sick over there. So that's one of the reasons why I eventually ventured into the nursing field. There's been a lot of incongruence and lack of trust for Western medicine, and sometimes this manifests in the gathering of information through medical histories. I know my parents are guilty of this as well as other Nigerians, or maybe, Africans in general. I was taught to not review my past medical history of relatives, things like cancer, diabetes, and others, to the doctor, not because of being shamed for it, but because they fear that they would be associated with the diseases. Not knowing, the medical history map actually helps in mapping out interventions to prevent such from becoming problems in the future. I feel some of the older generations are still operating under these assumptions. I'll stop right here today, though. I'm always imploring people to have a primary physician, and instead of guessing what the problem is, I'm wasting precious time with that bad headache, that back pain they had. Just visit your physician and physician instead. It can hurt. I just pray that the general system in Nigeria and other African countries will get better for good, so that we can all go back home like Trump said. Until then, my advice is eat well, exercise more, and live a peaceful life so you won't add unnecessary stress to your life. Am I forgetting anything? If I am, you guys can help me with the ones I'm missing. What are the perceptions that stand out about your country compared to living, here in the States? All right, I'm going to wrap it up here. Thank you very much for staying around with me till the very end. I hope you've learned something new today. So that's all for now, you guys. If you're new to this channel, once again, my name is Laraddiji. Ask questions if you have any. You can leave a comment as well. Also, you can like this video by giving it a thumbs up. To get notified of newly posted videos, why wait? Do that now. Click that red button. Subscribe. All right. The next video will be about School of Fraternal Twins and an introduction to my fraternal boy-girl twins. Do check out my suggested videos in the description box below. I'm hoping to read from you beautiful people very soon. Don't forget to love your neighbors as yourself, and remember to rest in peace. We all need to be living in peace. Stay blessed. All right? Stay blessed, you guys. I love you. I love you. I do. I do. I just do.